Hello viewers, welcome to lesson 5 Policy and Programs on Health and Environment. Some of the objectives of this lesson are: explain the policies and programs of health, explain the policies and programs of environment. It is recognized by all governments that investment on health is an investment on man and in improving the quality of life, and as such is a part of the strategy of human resource development. Health, which is a state of complete physical, mental and social well-being and not merely the absence of illness, disease or infirmity, is a fundamental human right, and the attainment of the highest possible of health is a social goal. Accordingly, the Constitution of India envisages the establishment of a new social order based on equality, freedom, justice and the dignity of the individual. National Health Policy 1983. Since the inception of the planning process in the country, the successive 5-year plans have been providing the framework within which the states may develop their health services, infrastructure, facilities for medical education, research, etc. Accordingly, a national health policy was evolved in 1983. It laid stress on the preventive, promotive and rehabilitative aspects of health care, realizing the need for establishing comprehensive and integrated primary health care services and family welfare services to reach the people's doorsteps, even in the remotest and far-flung rural areas. An integrated health care delivery system with maximum community participation had been developed. Two important targets that the country was set to achieve before the turn of the century in the area of health and family welfare were health for all and population stabilization by reaching net reproduction rate of unity. To this end, A. Primary health care services and B. National health programs had been augmented. Primary health care center generally covered a population of 30,000, but in hilly, tribal and backward areas, a primary health center is established for every 20,000 population. A community health center, which catered to a population of about 1 lakh, provides specialist services to the rural masses and had facilities for hospitalization, laboratory tests and X-ray. National Health Policy 2002. A national health policy was last formulated in 1983, and since then there have been marked changes in the determinant factors relating to the health sector. The main objective of national health policy is to achieve an acceptable standard of good health amongst the general population of the country. The approach would be to increase access to the decentralized public health system by establishing new infrastructure in deficient areas and by upgrading the infrastructure in the existing institution. Overriding importance would be given to ensuring a more equitable access to health services across the social and geographical expanse of the country. Emphasis will be given to increasing the aggregate public health investment through a substantially increased contribution by the central government. It is expected that this initiative will strengthen the capacity of the public health administration at the state level to render effective service delivery. The contribution of the private sector in providing health services would be much enhanced, particularly for the population group which can afford to pay for services. Primacy will be given to preventive and first line curative initiatives at the primary health level through increased sectoral share of allocation. Emphasis will be laid on rational use of drugs within the allopathic system. Increased access to tried and tested systems of traditional medicine will be ensured. National Mental Health Policy of India 2014. In April 2011, the Government of India constituted a policy group to recommend a mental health policy for the country. The policy envisages dynamic engagement and is expected to accommodate future thinking and developments in the field. This policy acknowledges the significance and importance of relevant and useful local knowledge and practices. While some of the policy recommendations are generic in nature, details have also been incorporated where necessary, especially to highlight neglected issues. Global thinking has been taken into account along with ground realities and variations of the Indian context. Significantly, the need to address the social determinants of mental health such as poverty, environment issues and education are duly recognized. This policy is inclusive in nature and incorporates an integrated, participatory, rights and evidence-based approach. Mental health issues are addressed in a comprehensive manner to address medical and non-medical aspects of mental health. This policy does not reduce mental health interventions to merely disease and disability prevention, and it takes into account the need for all stakeholders to work synergistically and achieve common policy goals. The strategic areas identified for action are inter alia, effective governance and accountability, promotion of mental health, prevention of mental disorders and suicide, universal access to mental health services, enhanced availability of human resources for mental health, community participation, research, monitoring and evaluation. The government believes that mental health is an integral part of our overall health endeavor. A holistic approach that recognizes strong linkage of body, mind and soul is necessary. Strengthening of health infrastructure must be effected along with addressing the social determinants of health and mental health. National health programs. Ministry of Family Welfare takes concerted measures to combat communicable, non-communicable and other major diseases. Some of the national programs are discussed as follows. National Surveillance Program for Communicable Disease. A systematic process of reporting of various diseases of public health importance as and when and where they occur to a designated agency responsible for taking effective interventional steps is known as disease surveillance. Its success will depend on 3R, that is the quality of diagnosis, recognition, the timeliness and completeness of reporting, and analysis and effectiveness feedback response. The National Surveillance Program for Communicable Disease launched by the government during 1997 to 1998 to effectively combat various emerging and prevailing communicable diseases. Objectives: capacity building at the state and district for early identification of outbreaks of communicable diseases, and 2. Appropriate and timely response to the outbreaks of communicable diseases. Program activities. The state governments through their existing infrastructure are implementing the program. Under the program, following activities are taken up. Surveillance system is strengthened through training of medical and paramedical personnel, dissemination of technical information and guidelines, upgradation of laboratories, modernization of communicable and data processing systems, and IEC activities to promote community participation in the prevention and control of outbreaks. National Vector-Borne Disease Combat Program. Vector-borne diseases are a major health hazard. In order to bring about convergence of ongoing schemes for malaria, Kala-Azar and filariasis, and also to expand program coverage to include dengue, the DHF and Japanese encephalitis, a national vector-borne disease control program is to be implemented in the country in the 10th 5-year plan with a plan outlay of rupees 1,370 crores. Keeping in view the national priorities and technical feasibilities, National Health Policy has envisaged goals of Kala Azar elimination by the year 2010 and lymphatic filariasis elimination by year 2015. National Anti-Malaria Program. Under this program, which covers all malaria-prone areas throughout the country, Government of India provides technical as well as logistic support to the state government as per the approved pattern to ensure the program implementation. National Filaria Control Program. As part of global efforts, pilot studies on single dose mass DEC administration initiated in 103 identified districts in 7 states was continued through the year 2003 to 2004 in a satisfactory manner. Kala Azar Control Program. Kala Azar endemic in Bihar, Jharkhand, West Bengal and sporadic in a few districts of Uttar Pradesh has been effectively contained through the Kala Azar Control Program, and there has been significant decline in annual incidence and mortality. Dengue Fever Program. Dengue situation remained in control until 2000 after 1996 outbreak in Delhi. AIDS Control Program. The first case of HIV detection in India in 1986, the HIV positive cases have taken a giant leap forward, resulting in an estimated 3.82 million HIV infections in India during 2002. 1st December is observed as AIDS Day all over the world. The theme Stigma and Discrimination under the slogan Live and Let Live has been rightly chosen for World AIDS Day. A multi-sartorial approach has been adopted by the government to tackle the problem of HIV/AIDS. HIV/AIDS control is being managed mainly through the World Bank assisted National AIDS Control Program. Phase 2 of this program is being implemented in the entire country with effect from April 1999 through 38 AIDS control societies. National Leprosy Eradication Program. The second phase of World Bank project on National Leprosy Eradication Program is operated since 2001 to 2002 for a period of 3 years with the objectives of A. Decentralizing the National Leprosy Eradication Program to states and union territories, B. Integrating leprosy services with existing healthcare systems, and C. Moving closer to leprosy elimination, that is prevalence rate of less than 1 case of leprosy per 10,000 population at national level by 2004 and 5. The fourth nationwide modified leprosy elimination campaign has been launched since August 2002 for further educating the public in respect of leprosy to encourage detection of hidden cases as well as their prompt treatment with multi-drug therapy. National TB Control Program. Revised National TB Control Program, which is an application of directly observed treatment short course, is being extended in a phased manner. Presently, more than 500 million populations in around 250 districts have access to DOTS. It is planned to cover nearly 856 million population under the RNTCP by 2006 with assistance from various international agencies. Active Program for Control of Blindness. Under the National Program for Control of Blindness, a plan of action for 10th plan, that is from 2002 to 2007, has been drawn up. This plan includes strengthening of infrastructure for eye care, including facilities of intraocular lens, human resource development and free service delivery of the poor. The revised strategies include reach-in approach, identification and treatment of bilateral blind persons, and strengthening of the follow-up of operated cases for provision of corrective glasses. School eye screening program for detection and correction of refractive errors and eye banking services are also proposed to be strengthened. Prevention and control of childhood blindness is also being given high priority during 10th plan. National Cancer Control Program. The activities undertaken during the 9th 5-year plan under National Cancer Control Program are continuing. Grants in aid released to 24 institutions for augmenting cancer diagnostic and treatment facilities both in government and private sector for establishing cobalt therapy and mammography units and for development of oncology wing. National Mental Health Program. To mitigate the hardships of the mentally ill patients, the National Mental Health Program was started in 1982 with a community-based approach. Currently, the district mental health program is being implemented. The thrust areas under the program identified are enlarging the coverage of the program to the entire country, modernization of mental hospitals, tackling the problem of long stay patients, upgrading the psychiatric wards in medical colleges. School health programs. School health program is a program for school health service under National Rural Health Mission, which has been necessitated and launched in fulfilling the vision of NRHM to provide effective health care to population throughout the country. It also focuses on effective integration of health concerns through decentralized management at district with determinant of health like sanitation, hygiene, nutrition, safe drinking water, gender and social concern. Components of school health program. Health service provision. Screening of health assessment of anemia, nutritional status, visual acuity, hearing problems, dental checkup, common skin condition, heart defects, physical disabilities, learning disorders, behavioral problems, etc. Basic medicine kit will be provided to take care of common ailments prevalent among young school going children. Referral cards for priority services at district, sub-district hospitals. Immunization. As per national schedule, immunization will be administered and fixed day activity coupled with education about the issue. Weekly supervised distribution of iron folate tablets coupled with education about the issue. Administration of vitamin A in needy cases. Prior information, education and communication and siblings of students also to be covered. Health promotion in schools through counseling services, regular practice of yoga, physical education, health education, peer leaders as health educators, adolescent health education, linkages with the out of school children, promoting health clubs, health cabinets, first aid rooms or clinics, capacity building, monitoring and evaluation and midday meal facilities. National Rural Health Mission. This program has been started from 2005. The main of NRHM is to provide accessible, affordable, accountable, effective and reliable primary health care, especially to poor and vulnerable sections of the population. Policy and programs for environment protection. Environment policy and legislations in India. In India, attention has been paid right from the ancient times to the present age in the field of environmental protection and improvement. Historically speaking, the laws relating to environment improvement were simple but quite effective, and people were aware of the necessity of environmental protection. The present day legislations in India are the outcome of the growing industrialization and population pressure. There are stated to be over 500 central and state statutes which have at least some concern with environmental protection, either directly or indirectly. Besides that, the common law and constitutional remedies relating to environmental protection are also there. Policies and laws after independence. The Indian Constitution as adopted in 1950 did not deal with the subject of environment or prevention and control of pollution as such until 1976 amendment. The original text of the Constitution under Article 372 subclause 1 has incorporated the earlier existing laws into the present legal system and provides that notwithstanding the repeal by this constitution of enactments referred to in Article 395, but subject to other provisions of the Constitution, all laws in force immediately before the commencement of the Constitution shall remain in force until altered, repealed or amended by a competent legislature or other competent authority. As a result, even after 6 decades of independence, the plethora of such laws is still in operation without any significant change in them. The post-independence era until 1970 did not see much legislative activity in the field of environmental protection. 2 early post-independent laws touched on water pollution. The Factories Act of 1948 required all factories to make effective arrangements for waste disposal and empowered state governments to frame rules implementing this directive. Under the River Boards Act of 1956, river boards established and empowered to prevent water pollution of interstate rivers. To prevent cruelty to animals, the Prevention of Cruelty of Animals Act was framed in 1960. Some states took initiative in the field of environmental protection. Orissa River Pollution Prevention Act 1953 and Maharashtra Prevention of Water Pollution Act 1969. While the Orissa Act was confined only to the rivers, the Maharashtra Act extended to rivers, watercourses, whether flowing or for the time being dry, inland water, both natural and artificial, and subterranean streams. Thus, there were scattered provisions for checking pollution of air, water, etc. But there was no unified effort in developing any policy concerning the pollution emanating from these areas. This position went up to the 70s. Meanwhile, concern arose over inter alia population increase, greater pollution levels, human impact on animal populations, and natural landscape and other aspects of resource depletion. It was the Stockholm Declaration of 1972 which turned the attention of the Indian government to the broader perspective of environmental protection. The government made its stand well known through 5-year plans as well as legislations enacted subsequently to curb and control environmental pollution. After 1970, comprehensive and special environmental laws were enacted by the central government in India. Important acts: the National Environment Appellate Authority Act 1997. The National Environment Appellate Authority Act 1997 provides for the establishment of National Environment Appellate Authority (NEAA) to hear appeals with respect to restriction in areas in which any industries, operations or processes shall not be carried out or shall be carried out subject to certain safeguards under the Environment Protection Act 1986. Biodiversity Act 2002. The Biological Diversity Act 2002 is a major legislation intervention effected in the name of communities supposed to be involved in the protection of biodiversity around them. The Act intends to facilitate access to genetic material while protecting the traditional knowledge associated with them. Water pollution. The Water Prevention and Control of Pollution Act was enacted in 1974 to provide for the prevention and control of water pollution and for the maintaining or restoring of wholesomeness of water in the country. The Act was amended in 1988, 2003. Environment protection. The Environment Protection Act was enacted in 1986 with the objective of providing for the protection and improvement of the environment. It empowers the central government to establish authority. Under Section 3, Subclause 3, charged with the mandate of preventing environmental pollution in all its forms and to tackle specific environmental problems that are peculiar to different parts of the country. The Act was last amended in 1991. National Green Tribunal. The National Green Tribunal has been established on 18 October 2010 under the National Green Tribunal Act 2010 for effective and expeditious disposal of cases relating to environmental protection and conservation of forests and other natural resources, including enforcement of any legal right relating to environment and giving relief and compensation for damages to persons and property and for matters connected therewith or incidental thereto. It is a specialized body equipped with the necessary expertise to handle environmental disputes involving multidisciplinary issues. The tribunal shall not be bound by the procedure laid down under the Code of Civil Procedure 1908, but shall be guided by principles of natural justice. The tribunal's dedicated jurisdiction in environmental matters shall provide speedy environmental justice and help reduce the burden of litigation in the higher courts. The tribunal is mandated to make an endeavour for disposal of applications or appeals finally within 6 months of filing of the same. Initially, the NGT is proposed to be set up at 5 places of sittings and will follow circuit procedure for making itself more accessible. New Delhi is the principal place of sitting of the tribunal, and Bhopal, Pune, Kolkata and Chennai shall be the other 4 places of sitting of the tribunal. Indian Forest Service. The Indian Forest Service aims at scientifically managing and protecting the forests of India. It was constituted in the year 1966 under the All India Services Act 1951 by the Government of India. The main mandate of the service is the implementation of the country's national forest policy, which envisages scientific management of forests and to exploit them on a sustained basis for primary timber products, among other things. The responsibility of managing the forests is done by the state forest departments under the respective state governments. The Government of India has introduced various policies and programs to improve the health of its citizens and to make sure that the downtrodden people are not left out. First, National Health Policy was enacted in 1983. It laid stress on the preventive, promotive and rehabilitative aspects of health care. Again in 2002, new health policy was brought. There are many programs related to health and the government tried to control all major diseases. Environment policies and programs also got attention from the government. Write a note on National Health Policy 1983. What are the objectives of National Health Policy 2002? List out any 5 health programs in India. Write a note on RNTCP. Write a note on the National Green Tribunal.